So I became a chair of the West Midlands BMA in August. It was when I was still in maternity leave, because I was getting very alarmed about what's going on with the whole dispute, and I thought, if I don't get involved, then probably no one will. So I felt really compelled to do something about that. I've been involved in BMA before when I was a medical student, and I feel that it was really important for us to have it, because it's a voice of doctors. So a little bit about life as a junior doctor. In a short sentence, is not easy. We change jobs roughly every 4 to 6 months, and it can be not only a change of a specialty, but also change of a hospital, change of a city. So sometimes we have to commute, an hour and a half from our houses to the job. That can start at 7:30, 8 in the morning. There is a lot of national applications involved. So after medical school, you have to apply for so-called foundation year 1 job, and then after you complete 2 years of foundation training, you have to apply for specialty training jobs, and then before you become registrar, you have to apply for more jobs. So it's actually very, very stressful, because you constantly have to apply for very competitive positions. Now, average working week is 40 to 48 hours. But the thing to note is we can work, and often, very frequently, work up to 12 days in a row. And a day can be anything up to 13 hours shift. In terms of night shifts, we do up to 7 consecutive nights of 12.5-hour shifts. Okay. And we, on average, do at the moment 1 in 4 weekends. I'm not so lucky, because I'm working acute medicine at the moment, and I do 1 in 2 weekends, which is really hard because I've got a 16-month-old baby, and I work part-time, but I still do 1 in 2 weekends at the moment. So how many of us are there? A lot. 55,000 junior doctors in the whole UK. Okay, so the new contract that will come, hopefully will not come in, will affect a large proportion of people, of doctors. And the term junior is often quite misleading in the way that I will be a junior doctor until I'm about 45. And I don't think it's that junior. So, it's really a long journey before we become consultants. And in medicine, you are either a junior doctor or a consultant. And on average, it takes about 10 years to train as a consultant. I'm doing now part-time, so it will take me about 18 to 20 years to become a consultant. If you want to train as a GP, it's 5 years. Shorter, but still, after 6 years or 5 years of medical school, you have 5 more years to train to become a GP, so altogether about 10 years. So it costs a lot of money, and it's a very, very long time before we become so-called seniors. So basically, when you come to hospital, most doctors you see are probably junior doctors, and the ones that deliver most of your care are junior doctors. Okay. So how long has this dispute been going on for? Actually quite a long time. It all started in 2012, when both government and BMA decided that the old contract is not really fit for purpose and some changes should happen. And both of the parties initially, we felt, had good intentions to start with and were prepared to make a better contract for everyone. However, as the time progressed, it became obvious it's not so. So in 2014, negotiations were not really going well. And so what government did was invite a so-called independent body called DDRB, which is Doctors and Dentists Remuneration Body. And in the past, they were known to be independent, and they were asked to provide some evidence of how this contract should change, what different things should be brought into place. Unfortunately, the outcome of this review wasn't very positive for doctors, and BMA felt that actually it wasn't really independent because the DDRB was really telling us what the government wanted. And the government said that they are prepared to negotiate based on the recommendation from the DDRB, but we had to accept all the recommendations before they were prepared to negotiate. And really, if you look at that, that doesn't equal negotiations. They wanted us to accept everything that was proposed before they said, let's negotiate. And we didn't want that. We thought, well, there's nothing to negotiate if we have to accept all of your proposals. And that's when we balloted our members about industrial action. And we had absolutely positively overwhelming majority of people wanting to take industrial action. I don't think it ever happened in the history of doctors. 98% of doctors were balloted, were in favor of industrial action, because they realized that this is really, really serious problem. Now, the issues with negotiation went on, because then the government realized we are quite serious about this, and we were prepared to take industrial action, so they wanted to come back to the table. It wasn't very successful, so we asked another body, ACAT, to actually help with the negotiations. Some small progress has been made, but overall, in a nutshell, we haven't really moved that far, and that's why the first strikes in history really happened in January, but the first one we had more in February, we had more in March, in April, and you are probably aware that next week, on Tuesday and Wednesday, something that never ever happened in history will happen, and it's going to be the full withdrawal of junior doctors here. So there will still be consultants, but all junior doctors in training will go on strike next week on Tuesday and Wednesday. So why are we so unhappy about it? Why is the new contract so bad? There is quite a lot of contentious issues, but I'll just start with the one that I always get asked most about, which is the money. When I get interviewed by the radio, they say, it's all about money. You say it's not, but it's all about money, and you get a pay rise and you're striking. And I just want to put it clear here that we are not getting a pay rise. Government is very clever, and they said we'll get 11% pay rise in our basic salary. But our salary is made up of basic and what is called a banding, which is a percentage increase based on how many unsocial hours we do. For average doctor, it's 40%. So we've got basic plus 40%. Government is removing the banding, so it's removing 40% of our salary, and are saying, but we will increase your basic by 11%. And when you do the basic maths, that's roughly 30% pay cut. But this is not mentioned anywhere in the press, but we know it's a massive pay cut. So the diagram there just tries to explain it. That actually what they are doing is removing the banding, and they are saying we might put it to the same level with different things that incentivize other professions to go into, for example, psychiatry, emergency medicine, maybe academia, but it's actually very, very unclear about how these increase in pay will be distributed. In the new contract, there is not much mention, and from what we understand, it's really mainly a massive pay cut for junior doctors. So what else is it about, and why are we really unhappy? First of all, we don't want a contract that is imposed, because as any other profession, imposition is a really bad practice, and I don't think anyone would be happy to have something forced upon them. So our first thing we want the government to do is to remove the imposition. Now, another thing we want to do is for them to recognize that Saturday and Sunday is still a special time. And I'm talking now as a mother. For me, Saturday and Sunday is a time I can be with my baby and with my husband. I already work 1 and 2 weekends, and it's really tough. If I'm asked to work more weekends for much less money, then I'm going to really struggle. Because if my husband can't look after my baby, and I have to put my baby to childcare, the childcare will cost me more than what the government will pay me for working Saturday and Sunday. Because what they are saying is they'll remove the extra pay for Saturday and Sunday and will pay us as a basic salary, which actually isn't brilliant. And they are only prepared to pay a little bit extra if we work more than 1 in 4 weekends. But we feel that this is really unfair, because up to now, Saturday and Sunday is recognized, and in society in general is recognized as a time that is a bit special. And if you're asked to work, and if we work, it's very intense hours we do, we would like to be recognized for such. One thing we don't agree is definition of night shift. So government is saying that if you work until 2 a.m., that's not a night shift. Now, someone who works night shifts, I know that if I get to bed at 3 in the morning or at 9 in the morning, I'm still equally knackered the following day, okay? So if they are saying to me that if I work until 2 in the morning, that's still considered as a day, and then I could potentially come back to work the next day for, let's say, 12 o'clock midday, it doesn't make sense. They need to realize that 2 a.m. is still going to disrupt your sleeping pattern in the same way as if you work the whole night until 8 o'clock in the morning. Now, another thing that I will not bore you with, but it's something called safeguarding. So at the moment, there's few things put in place to make sure trusts are not overworking us. And if they do, we've got really good robust system to appeal to the safeguards. So then we can either be paid more or the trust need to change the route as we work. And it happens all the time. The way I work at the moment, we are in one of the banding appeals because we feel we work too much, we're not being paid for it adequately. Government wants to remove it, but what they are putting in place isn't very robust. And they are saying that there will be financial penalty that will go back to the trust, which actually it doesn't make sense because they will fine the trust, they will overwork doctors, but the money will go back to the trusts. So it's not going to really work because they will just put money in their own pocket again. The one thing you're probably aware are the misuse of statistics regarding the weekend mortality. Jeremy Hunt scared everyone with saying, you're more likely to die if you come to hospital on a weekend. And this is simply not true. What he did, he misinterpreted research that was already out of date. And he's been caught on this on several occasions, yet still nothing really big came out of that. And it is really problematic because we don't want our patients to come to hospital on a weekend and think, oh no, I'm more likely to die because it's the weekend. But it's not true. People are more likely to die on Wednesday than at the weekend, according to the statistics that are actually valid. Okay? Now, what we want is contract that is, first of all, not imposed on us. We want a contract that is safe to you guys, safe to our patients, because if I'm going to work even more unsocial hours, I'll be so exhausted that my mind will not be thinking properly, and I can be making fatal mistakes when I am prescribing drugs, when I'm treating patients that are really acutely unwell. So we need to be well rested and feel like we are ready to treat patients. And if we are supposed to work more evening shifts, more weekend shifts, when will we have the time off? Well, the one possibility is we will have to have the extra time off in a week. So if I work many more weekends, I'll have to have a day off on Monday and Tuesday. But that means there'll be less doctors on Monday and Tuesday than there are at the moment. So what is going to happen is just you take, two, let's say if we say toes, you've got a jump for 5 toes and you've got 7 toes. So you will still have 2 toes that are not having jam. So it doesn't really matter if it's going to be the weekend or it's going to be the weekday. So this is something we are really pushing through. It has to be fair, safe, and it has to recognize doctors for what we do. So we don't want to be made look like we are greedy doctors. All we want is to be paid accordingly for what we do. I don't want to stop working as a doctor because I can't afford my childcare that is in those unsocial hours if this new contract comes through. Okay, so industrial action, a little bit about that. You probably would have heard about the ones in Birmingham. Locally I was at Coventry and at Warwick. It's happened obviously across the whole UK, and it's been quite it's been enormously well supported by public, and it's something that is very positive for us as young doctors because we know the public is behind us, and I think it's forever growing in terms of public's understanding that this issue is not because just junior doctors, this is the whole of NHS. If the government gets doctors, junior doctors, then the next one probably will be consultants, next one will be nurses and other allied healthcare practitioners. And then, before you know it, the whole NHS is going to be totally destroyed. Because if this contract goes through, I already know it, a lot of my colleagues are going abroad. A lot of them are thinking of retraining as working in some different profession. A lot of my mum colleagues are thinking they will have to stay at home, especially if you have more than 1 kid. it's not really worth it anymore to work because your childcare will cost more than if you work. One thing to note about an industrial action is I really want you to know that for those who need the care, there will be care. So for the next strike on Tuesday and Wednesday, we have been assured by our colleagues, consultants, that really sick patients will get what they need. There will be some disruption, and I really apologize for that. There will be some elective operations that will be cancelled, some routine appointments, outpatient appointments will be cancelled, but people who really need care will receive the care. I think, really, I would like to actually open the floor to the questions. I'll just check for there also there. Well, one thing, how can you get involved? How can you help? So I think by you